Welcome back to PharmaZone, A to Z of pharmacy. One stop where you can learn anything related to pharmacy or PharmD. Continuing our journey into the pharmacology world, here I am bringing the second chapter or the second part of the autonomic nervous system or the autonomic pharmacology. So let's get right into it. And if you're enjoying or learning anything new from our video, a sub to the channel would really be encouraging. In the previous video, we had ended with the drug classification of the autonomic nervous system. That is, it is divided into the sympathetic system and the parasympathetic system. The parasympathetic system is further divided into the cholinergics, or it is also known as the agonists, and the antagonists, that is the anticholinergics. So in this video, we are going to study in detail about the cholinergics. So let's begin. The cholinergic system. Acetylcholine, an ester of choline, is the neurotransmitter of the parasympathetic system. The nerves that synthesize, store, and release acetylcholine are called cholinergics. The release sites of acetylcholine are the ganglia, all the preganglionic fibers of autonomic nervous system or ANS, that is at both the sympathetic and parasympathetic ganglia, the postganglionic parasympathetic nerve endings, the sweat glands, the sympathetic postganglionic nerve endings supplying to the sweat glands, the skeletal muscles, somatic nerve endings supplying the skeletal muscles, the adrenal medulla, the CNS, that is the brain, and the spinal cord. Next, how is acetylcholine synthesized? Acetylcholine is synthesized from acetyl-CoA and choline, catalyzed by the enzyme choline-acetyl transferase. This acetylcholine is stored in small oval vesicles in the cholinergic nerve terminals. So, next let us see about transmission of an impulse. When an action potential reaches the presynaptic membrane, acetylcholine is released into the synaptic cleft. This acetylcholine binds to and activates the cholinergic receptor on the postsynaptic membrane, leading to depolarization of this membrane. Thus, the impulse is transmitted across the synapse. Acetylcholine released into the synaptic cleft is rapidly destroyed by the enzyme acetylcholinesterase. Then the postsynaptic membrane is repolarized. Cholinesterases. Acetylcholine is hydrolyzed to choline and acetic acid by the enzyme cholinesterases. Two types of acetylcholines are present: true cholinesterase at neuron, ganglia, and neuromuscular junction. Pseudocholinesterase, also known as butyrylcholinesterase, which is present in the plasma, liver, and other organs. Next, these are about the cholinergic receptors. There are basically two types of cholinergic receptors, that are the muscarinic receptors and the nicotinic receptors. Muscarinic receptors are present in the heart, smooth muscles, glands, eyes, and the CNS. Muscarinic receptors are G protein coupled receptors. 5 subtypes of muscarinic receptors M1, M2, M3, M4, and M5 are recognized. Nicotinic receptors are present in the neuromuscular junction, autonomic ganglia, and the adrenal medulla. Nicotinic receptors are ion channels made up of 5 subunits, that is the 2 alpha, 1 beta, 1 gamma, and 1 delta. Binding of acetylcholine to alpha subunits opens the channel, allowing the entry of sodium into the cell. In this image, we can observe that acetylcholine binds to the sites on alpha subunits, resulting in opening of the channel. Next, let us see the most important part of the video, that is the cholinergic drugs. Cholinergic drugs are chemicals that act at the same site as acetylcholine and thereby mimic its actions, and hence they are known as parasympathetic parasympathomimetics or cholinomimetics, and they're also known as cholinergic agonists. Agonist is anything that mimics its action. So here, cholinergic drugs mimics acetylcholine's actions, and hence it is also known as cholinergic agonist drugs. So this is a classification of the cholinergic drugs. They are mainly divided into cholinergic agonists or anticholinesterases, or it is also known as cholinergic antagonists. So cholinergic agonists is further subdivided into choline esters and alkaloids. Choline ester is subdivided into the drugs, that is acetylcholine, methacholine, carbachol, and beta-nicol. Alkaloids, the drugs that come under alkaloids are muscarine, pilocarpine, and aricoline. So in this particular video, we will be studying completely about choline esters, and from alkaloids it will be covered in the next video. Let us understand the actions of acetylcholine. Like we have seen earlier, we know that acetylcholine has both muscarinic and nicotinic actions. Acetylcholine is taken as the prototype of parasympathomimetic drugs. So let us see about its muscarinic actions. Muscarinic actions resemble the actions of the alkaloid muscarine found in some mushrooms. These actions result from the stimulation of muscarinic receptors by acetylcholine. So muscarinic actions include, the first one that we are going to study about is in the heart. The action of acetylcholine is similar to that of the vagal stimulation. It depresses the SA node and thereby reduces the heart rate and force of contraction. In larger doses, AV conduction is depressed. Next, its action on blood vessel, it relaxes the vascular smooth muscles and dilates the blood vessels of the skin and mucous membrane. The BP falls due to a fall in total peripheral resistance. In smooth muscles, acetylcholine increases the tone of all other non-vascular smooth muscles. In gastrointestinal tract, tone and peristalsis is enhanced, sphincters are relaxed, resulting in rapid forward propulsion of intestinal contents. In urinary bladder, detrusor contracts and trigonal sphincter relaxes, promotes voiding of urine. And in bronchial smooth muscles, it contracts, resulting in bronchospasm. Next, in secretory glands, acetylcholine enhances the secretion of all glands like salivary, lacrimal, nasopharyngeal, tracheobronchial, gastric, and intestinal secretions. Sweating is also increased. Enhanced bronchial secretions and bronchospasm result in severe dyspnea. This is one of the ADR or adverse drug effect that we have to note down here. That is, increase in bronchospasm may result in severe dyspnea. In eye, acetylcholine brings about constriction of pupil. Constriction of pupil is nothing but meiosis by contracting the circular muscles of the iris. Stimulation of muscarinic receptors present in the sphincter pupil results in meiosis. Drainage of aqueous humor is facilitated and intraocular pressure falls. Ciliary muscle contracts, resulting in spasm of accommodation. Next, let us see the nicotinic actions of acetylcholine. These effects resemble the action of alkaloid nicotine and are brought about by stimulation of nicotinic receptors by acetylcholine. So its first effect is in the neuromuscular junction. Acetylcholine brings about contraction of skeletal muscle by stimulating NM receptor present in the neuromuscular junction. Large doses causes persistent depolarization of skeletal muscle, which may result in paralysis. Again, an ADR to be noted down here, that is adverse drug reaction. Next, in the autonomic ganglia, acetylcholine stimulates the sympathetic and parasympathetic ganglia and the adrenal medulla. In the CNS or the central nervous system, Acetylcholine is a neurotransmitter at several sites in the CNS. The important actions of acetylcholine are summarized here. So we have seen that in the cardiovascular system, it leads to decrease in heart rate and decrease in blood pressure. Non-vascular contraction leads to increased gut peristalsis and promotes urine voiding. In smooth muscles, bronchospasm is observed, and we have also seen that it may lead to dyspnea. That is an ADR, like we have discussed. And in certain glands, it increases the secretion, like lacrimal, nasopharyngeal, and then salivary glands. So in eye, it may cause meiosis and spasm of accommodation. So in neuromuscular junction, muscle contraction is observed. This is the nicotinic action that we have discussed. And in ganglia, it causes stimulation. Now we know the actions of acetylcholine. Let us study the uses of acetylcholine. Acetylcholine is destroyed in the gut when given orally, and hence it is mainly given on intravenous administration. On IV administration, it is rapidly metabolized by pseudocholinesterases in the plasma and by true cholinesterase at the site of action. Therefore, it is not used therapeutically except occasionally as 1% eye drops to promote meiosis during some eye surgeries. Esters of choline are effective orally, like carbachol and betanacol. They are both resistant to cholinesterases and have longer duration of action. Their muscarinic actions are prominent with a sustained effect on GI smooth muscles and urinary bladder. Methacholine is rarely used. Carbachol is used in glaucoma. Betanacol may be used in hypotonia of bladder, hypotonia of gastrointestinal smooth muscles. In some cases of preoperative paralytic ileus also it is used, and in cases of urinary retention, and in xerostomia as an alternative to pilocarpine. Let us see the adverse effects or the ADR of the cholinergic drugs, the common ADRs, which includes diarrhea, flushing, bradycardia. Bradycardia, like we have seen in the muscarinic actions of acetylcholine under the heart, that is, it decreases the heart rate. Hypotension, we have also seen there that it decreases the blood pressure. Sweating, syncope, bronchospasm. Bronchospasm, we have seen that it under the smooth muscles it contracts, and hence there are chances of dyspnea also. And then salivation, like we have discussed, under the secretory glands it increases the secretion, leading to increased salivary secretions, and hence that is why both sweating and salivation is one of the most common ADRs of cholinergic drugs. So now that we have come to the end of the video, let us make a quick recap. Cholinergic drugs are divided into esters and alkaloids. So under the esters, we have studied about acetylcholine, methacholine, carbachol, and betanacol. Coming to the actions of acetylcholine, we know that they have muscarinic and nicotinic actions. Few of the major actions are: in CVS, it decreases both heart rate and blood pressure. In non-vascular contractions, it increases gut peristalsis and promotes urine voiding. In smooth muscles, it causes bronchospasm. In glands, it increases secretion. In eye, it causes meiosis. In neuromuscular junction, it causes muscular contraction. And in ganglia, it causes stimulation. These are the basic uses that you must know under the cholinergic drugs. And coming to their ADR, we have seen that they cause bradycardia, hypotension, salivation, sweating, bronchospasm, diarrhea, and flushing. So this is a quick recap of this whole video. So in part 3, we will be covering cholinomimetic alkaloids. And then, so about this video, hope you guys enjoyed. If you have any suggestions, kindly give it in the comment section. And as usual, notes will be available in the descriptions. So thank you. And like I said in the beginning of the video, a small subscribe or a quick subscribe would be really encouraging. And kindly like and share also to your fellow PharmD students so that it would help them also. Thank you.